Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart to heart conversations about their day to day lives while sharing their expertise for improving your health and wellness. Welcome to the Healers Café. And today I have with me Dr. Sam Zand. He's a board certified psychiatrist and a leading voice in holistic mental health care. With a passion for integrating traditional psychiatry with innovative, evidence based approaches, Dr. Zand helps individuals achieve lasting mental wellness by addressing the mind, body, and spirit. Now, his approach goes well beyond symptom relief. He focuses on root causes, guiding patients towards sustainable healing through mindfulness, nutrition, movement, and mindset shifts. I'll just add that you're also a recognized expert in ketamine assisted therapy, utilizing sublingual ketamine treatments to help patients struggling with depression, anxiety, PTSD, and other mental health conditions. I think I'm going to leave it at that. Long bio, lots to share, but we have a short time together, so I think we're going to start with that. And
No,
welcome.
thank you.
And yeah, what got you started on this journey? Like, well, I guess what I'm thinking more is that the need for the holistic component in
Right.
psychiatry.
Yeah, when I started my medical school, I was a kid, right? I was lost in my 20s. I didn't really know fully what I wanted to get into with medicine. I thought psychiatry, I thought mental health called me, and my dad's an engineer, my mom's a psychologist. And so engineering the mind was always interesting to me. But every early exposure I had to psychiatry made me feel like, no, I don't know if this is what I want to do with my life. And finally, when I made the plunge, it was more of a rebellious feeling that I had, where I felt like we had to clean up the industry. We had to improve some archaic strategies. And I think that young naivete really helped me in those early years because I didn't digest everything they were telling me as truth, as science. And in our field, in brain science, nothing really is 100% fact. We don't understand the brain. And so to assume that, I think, is a level of arrogance that we know what we're talking about. And so to be a humble student and to challenge things, to question things, I continue to embody that nature now without the rebellious feeling. I feel like as an industry, we're making strides together. We're calling out our own shortcomings. We're noticing that some things didn't work, and we're noticing that some other modalities are working great. And really, it brings us back to if we can get away from what science has taught us in the last 50 years, well, what has life taught us in the last 5,000 years, in the last 500 years? And that's where some of these holistic strategies become very exciting.
Wow. So you were not one of these people that when they said, "Oh, your gut health matters," maybe just because the neurotransmitters are made there.
Right.
You're not
Yeah,
one
where we just
of
called
those.
that woo-woo back in the day, right? It's how does what we eat affect our brain? It doesn't make sense. It's it's comical now, right? Because most people, the science is caught up. And I think that's what's interesting about the last just 10 years is YouTube and podcasts and the education is all at our fingertips now. Whereas before, education was safeguarded, it was gatekept, it was protected, it was passed on. I just read the Hippocratic Oath again.
Right?
And one of the fascinating parts that I forgot about in the Hippocratic Oath was that we need to share education. Those of us who have given this oath, we need to share it on to those who also have taken that pledge and that oath. And then we also need to keep it from those who may not use it appropriately. And that was interesting to me because we're not living in that era anymore. 20 years ago, a patient said, I looked this up on WebMD. The clinician would kind of give them that judgment like, hey, we shouldn't be Googling our illnesses, right? But now I'm telling my patients, you should AI double check everything that I say, that any doctor says, anything you hear, get more education because we don't know what's true and what's not. And so I think that that blends into more of an alternative holistic practice rather than a scientific dogma that we have to follow.
Yeah, no, and I think that the researching is important because it's also taking charge of your health.
Mm,
And question mark though is if you Google it, you may not find it either because, Google has also changed its whatever it's called, algorithms. I can
Right. The algorithms are designed in certain ways.
exactly
Definitely.
natural things like Mercola just disappeared. And unless you know he exists, you can't, you'll never get something, a natural approach, right? So what do you recommend there for patients who they want to know if this is truly a so-called mental illness or is there anything natural? How do they get more informed in
Yeah,
this
I
current?
think the algorithms and the assessment tools that we have, it's fascinating because part of this work is realizing that it's biological, it's psychological, it's environmental, and it's spiritual. How are we ever to track our spiritual health with metrics, let alone our biological or psychological health completely? And so while we're using the DSM and the PHQ-9s and all these surveys and scales and assessment tools, really, I think the introspection of self, if we want to understand what we're going through, is just simplifying it into those categories and not adding any metrics to it. How am I doing biologically? How is my physical health? How's my sleep, my nutrition, my activity? How is my nervous system regulation? And then let's look at the psychological health. How is the conversation with self? How is our self-image? How is then our social and environmental health, our relationship with the world around us? And then spiritually, how do we interact with those things that we cannot define, whether consciously or subconsciously? And so I think to try to objectify this journey into numbers and surveys does a disservice in many ways. And it becomes that open conversation that could use some professional guidance. It can also be done individually. It can be done with technological tools as well. But I think just being open to all of this overlapping is the key rather than trying to simplify it.
Yeah. No, and I like the distancing you have with statistics, because I know in as a naturopath, now I'm no longer practicing, I have to say that publicly. Um, but what's interesting is that patients would come and say, well, they say the stats about my condition, blah, blah, blah. I said, well, the stat about you individually is individual, you know?
Yeah,
And that's the bottom line is, you have to go introspective in a lot of the assessment. You know,
right.
so how let's see, where can we start with all your wealth of knowledge? Maybe describe a little bit then. Yeah, when a patient comes in, what's sort of the process that you might, so they may be they may call themselves depressed or they've been labeled so by somebody
Right.
and they're coming in. Where do you go from there?
Great question. And we train clinicians, every month, new clinicians in new states. And the number one thing we start with is rapport building, is meeting the patient where they are, meeting our community member, whoever it is, where they are, because that's the one-of-one quality that you talked about that I think is most important in my space as a psychiatrist. If I was a surgeon, yeah, everybody's different, but more or less physics are the same, and someone has a different chemical makeup, a different genetic makeup, a different cardiovascular history. But the one of one here is that not only is everybody different in their biopsychosocial spiritual makeup, but where they are in their journey is different, and the way that they believe that they are doing, the way that they perceive themselves, the way that they perceive the visit itself. I just saw a 16-year-old today who she didn't sign up for the visit, with me. Her parents signed her up. And that's a very different approach to care because she's not looking for care. She's feeling like she's being made to feel wrong, like there's something broken that needs to be fixed. And so, starting with her, I wouldn't just jump into, how are we doing? Tell me about all the things in your life. Because then she'll start to feel judged and she'll start to feel like, well, now I need to defend myself and not talk about the bad things in my life and maybe focus on the good or blame others so that I'm not made to be the bad one. It's my parents who need the therapy, not me. Um, so the visit with her is very less clinical and more so exploring what's important to her and just letting her vent and tell me about how much you hate your parents. Like let's just start there. And so meeting the patient where they are is, I think, the key. From there, we do an introspective exploration together so that we don't feel judged. We don't feel there's something wrong with us. And then we use our experience and knowledge and intuition to start to prioritize what the person's ready to work on, shed a flashlight on things maybe they didn't notice that need to be worked on, and be empathetic and compassionate and gentle about it. And then, if asked, we'll talk in clinical terms and DSM terms, but I never bring it up.
Mhm. Wow, that's so refreshing. Yeah, yeah, it's from a naturopathic perspective, though I should, again, this is not publicly accepted by the board of naturopaths because we are very much trying to be green allopaths. So, using these fancy terms and the diagnosis is something that, is looked highly upon, right? It's when you're trying to achieve something instead of recognizing what you have. That's
Right.
profession's hat. But anyway, I'm not in that. But the first thing I would do is they'd say what their diagnosis is, and it's like, so what do you know about this? How true is it for you? And it's like suddenly they kind of lose that hold, and it sounds like the moment they don't identify that this is absolutely them and there's no way out of this, it's like healing becomes a possibility. A dialogue really happens, so it's great. Not I love not labeling immediately because it's so hard, you know.
Removing constraints if they've already been built, and not adding those constraints if they haven't been subject to that. Most of our patients have been in mental health work or psychiatric work, so there's a lot of unwinding and unlearning. But those who are brand new to it, I think it's such a wonderful opportunity to reinforce that there's nothing wrong with us. When we focus on diagnostics, we're looking for what's wrong. Instead of, we can spend a whole session focusing on what's right and just building somebody's brain that way. And there's nothing wrong with that approach, but it's not taught because it's not in the diagnostic culture that we've been trained in.
Mhm. So where do you feel, or what are the aspects that have contributed to what I would call the downfall of psychiatry in its, in the way that I would say it was practiced, still is by some, but definitely there's a move away from that. What do you feel has made it so, What?
Yeah, I think frankly, it's just that it has not been effective. I mean, we go back,
Mm,
what is it? It's 80 years, and we had the lobotomy, and we evolved from that, and it was killing 1 in 3 people or 1 in 6 people who were in the procedure, right? 1 in 10 maybe, I'm not sure, but far too much to kill anybody because they're feeling depressed or anxious. Now, we've evolved from barbaric strategies of tying people up and doing lobotomies to a hyper focus on psychopharmacology. And when you think about the 50s, when psychopharmacology became an industry, it wasn't malicious. And I think that's my maturity and my growth is I used to demonize Big Pharma. I still don't have the best thoughts about them, but I have a little bit of more hope for us all societally.
What would your life be like if you were pain free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
Than I did before. Because in the 50s, you think about psychopharm was trying to solve the schizophrenic issue, in which we were improving upon alternatives of tying people up. Now, instead, we can give them a pill, and maybe that actually makes them more functional in society. Now, it wasn't the best outcomes initially, but it opened a door that made sense. When we
Mm.
applied that same strategy to daily depression, to just bread and butter depression, to the well-worried, that doesn't make as much sense, in my opinion, to change somebody's whole entire chemical makeup, because what's the alternative approach? What's the alternative risk if we don't? And so all of a sudden, Prozac in the 80s becomes the new marketable item, right? And it's popular and it's fun and it's easy. I think because we've then let psychopharm dictate how psychiatry has practiced for so many years, we've just blindly been following this and instead realizing that only 30% of people get better on this medication. And after a year, really the numbers are showing maybe 10% after the burnout continue to feel better. Are we even really doing anything? The serotonin hypothesis is largely questioned and sometimes debunked. Then society loses hope. And they're like, I'm not doing this anymore. So perhaps the drug company said we have to do better. And there's something else because this maybe isn't working. We're losing clinical buy-in and we're losing patient compliance. It was 2019 that I think we really took a turn, and that's when Spravato got FDA approved for depression. When that happened, the first thing that stood out to me, I didn't know much about ketamine or esketamine, is that the dosing frequency, twice weekly for the first month, once weekly for the second month, once every 1 or 2 weeks after that. So I'm thinking no longer are we telling somebody there's a chemical problem that needs to be daily adjusted. More so, we're saying there is a brain optimization that can happen once a week or once every 2 weeks. And then we learn there's so much more therapeutic potential after the brain opens with this type of medication. So that to me has been now the doorway to a whole new way of practicing psychiatry that becomes experiential. It's more about neuroplasticity and opening the brain rather than changing chemicals in the brain. And it brings us back to our homeostasis. It brings us back to our inner healer because we just want to get the clutter out of the way so that we can be our best self rather than add more to the mess.
Mm, that's beautifully stated. Also from the actual experience of what it's like to um, to deal with a person like that has this issue, right? Whereas when you're sitting on the outside from, pharmaceutical companies, they're driven by obviously profit because they're shareholders. But it's true, if a product doesn't work, that's also sort of their end, I mean, not necessarily right away, because
Yeah, they try to squeeze it as long as they can.
after numerous researches, and then eventually, finally, the side effects are shown, and
Right.
people lose full or discouraged in that,
Yeah.
but no,
Quick fascinating fact, there are zero SSRIs in clinical trials right now. We have evolved past that. It's the new lobotomy. We're not making it anymore because
yeah.
we realize it's just not as effective as we once thought. Now, I also don't want to shame anybody who's on SSRIs. I still write SSRIs. They still work as poorly as we thought they did, but when they work for people, they work well. They just in percentages, they don't work for most people. And so to your point, we're evolving, old tools. If you're a surgeon using a scalpel from 70 years ago, your patients wouldn't be too happy. And so we need new shiny toys to actually work.
Mhm. So, how can you describe a little bit further this sort of spiritual, you know, component to this journey, this inner journey?
Yeah, that's my favorite part about how modern psychiatry is meeting ancient cultural medicine, shamanistic practice, spiritual work. In old times, if we were feeling depressed, if we were feeling anxious, if we were having panic attacks, if we couldn't sleep, in most cultures, we would come together. We would come to help support that person. We'd use community. We'd go to our elders for wisdom and advice. We'd go to nature for answers. We'd go to our spirituality for faith and support. None of that is in modern medicine. And so, what ends up happening, I think, when we start to apply strategies that opens the mind and pulls us out of our default mode network that's filled with societal pressure and clutter and distraction, then all of a sudden we get back to these humanistic ways of understanding that what I really need and miss is connection in my life. What I really crave is fulfillment and giving back and feeling like I have purpose and I can be of service. This is inner wisdom that we all have. We just have to get rid of the clutter. And so that wisdom, I think, connects us to the spiritual elements of life. Why are we here? What's the point? What happens when we pass? What was this life like before my existence? Are we truly connected, or is this an individual experience? The brain starts to open up. And I don't think Prozac or Wellbutrin does that really, as well as what we're seeing in these neuroplastic meds and experiences.
Mhm. Well, definitely. I mean, the few that come, to get support naturopathically often say they just feel dumbed down, like less able to absorb anything. And that's not a good way to process anything, is if you can't actually experience or go through it. It's not about repeating. I mean, that was the old psychology, repeat, repeat, until
Mhm.
the brain is wired to believe the same thing again. But I think also all the development in neuroplasticity has opened up the pathway to, so many more options. Yeah.
There was a recent story Michael Pollan wrote. I believe it was in the uh, I forgot which publication, but he talked about, I'm not sure if you've seen it, experiment where they found spiritual leaders from all different walks of life, and they brought them through Johns Hopkins and NYU, a combined research program where they gave them psilocybin. And I think the skeptics would say, the religious skeptics would say that this drug might change the way we feel. It might alter our perception of what we know to be true in our religious faith. But in fact, the exact opposite happened. For most of them, they actually leaned fully more into what they felt spiritually. They were able to even, most of them said it was one of the top profound spiritual experiences they had. And these are spiritual leaders who spend their entire life, their career connecting with their spirituality. And so it just reminds you that the human experience gets in the way of spiritual connection. And if we can remove some of that clutter and get in that meditative state, whether it's through medication or meditation, then all of a sudden we open a channel to spirituality that even the most practiced spiritual leaders notice benefit from.
Mhm.
So that to me is an interesting part of this work. Psychiatry is a industry. If you break down the etymology, psyche meaning soul, Greek word, iatry, healer or healing. And so we're healing the soul here. We're not really just focusing on emotions or chemicals or brain patterns. We're trying to help people understand a part of life that isn't scientifically understood. And everyone has their own unique meaning and sense of understanding that I think is important in this journey.
Mm, yeah. Um, yeah, no, that's very interesting. The one thing that came to me is, this awakening process that so many people talk about. There's spiritual people talking about it. There's also not necessarily spiritually aligned to any particular faith, but this increase in consciousness that is happening, whether it's planetary or because we're the age of Aquarius, or I'm not going to go into all the theories, but there's many of them. But one of the things that is coming out so much is the need for community, the reconsidering all our core values, and also maybe some of the history that we didn't know about ourselves, the frequencies, the healing available from this world, nature even more pronounced. Do you have any comments on that whole field without limiting, anywhere in there?
Yeah, I really do think that we need to tap more into understanding this human experience not as an individual experience, but as a connected experience. And that's not just the humans, that's, as you alluded to, the universe, the planet, the way that these things happen in waves societally. We outgrow our environment, and then we either need to change the environment or change something we're doing. And all of that, if we think of the earth breathing in a way, right? The way that it absorbs the sun, the way that the waves move, the way that it's turning on its axis, all of this, there's some magic in that that we don't understand fully. And the theory is that ancient civilizations understand that better than we do in modern medicine. In some ways, I believe that. It's kind of that when you're taught one dogma, you're blind to others. And so what fascinates me, and still young in my career, I want to learn more about other strategies that I'm not fully familiar with. I think it's interesting how Western medicine has adopted some of it, though. We think about magnetic waves and the way in which I'll go to Sedona and people will talk about vortexes and vortices, right? In the way that energy, and I'm not an expert in that, but I am an expert in TMS, transcranial magnetic stimulation, which is actually harnessing magnetic energy to wake up parts of the brain that are dormant when we're depressed. That's our best attempt of the wizardry of this magnetic wave, right? But who's to say that the person who's seeking it directly from the earth is doing it right or wrong? I want to learn more about that, and hopefully AI and machine learning and all of this bridges some of those gaps in education.
Yeah, I hope it bridges. And again, with technology, it's always who's in control of it. It's like in and of itself, I think it's all right. It's like if we are the ones who can use it, can create the relationship with, and it's not governed by, a generalized, ah, like propaganda machine of
Yeah.
sorts. I think it definitely could be for our expansion. I'm not one who believes that we should throw away all technologies, because I have a feeling that we're about to discover technologies that existed before, that we have not been able to see. Like it looks like these, you know, electric cars, but without plugging in, were actually part of our history that we're not familiar with, or some.
Yeah,
Yeah,
I believe that there are so many technologies that have been buried and
yeah,
then yet to be rediscovered. And so it's an exciting concept where, yeah,
yeah.
let's combine all wisdom and then figure it out. I think we're getting there.
Okay, we got one more minute. I'm just going to ask you to close with whatever you want to leave the inspired person with.
Yeah, I think that this conversation about spiritual health is so important. And when we're looking out for our own wellness, in my experience as a psychiatrist, I can look at the biological, we can talk about meds, we can even talk about therapy ad nauseum. But until we talk about the spirit, then we're not really impacting the change at its core. And I think our computer processor, our soul, whatever you want to call it, that's really the part of our health that needs the most nourishment. And the tough part is that words misinterpret the spirit. And so we have to learn how to evolve beyond the cognitive, beyond the words, and get more into the feeling. And this is where I'm forever a student and always trying to help others and light that path for them as well.
Wonderful. Well, thank you so much for spending your time educating us and sharing your wisdom.
Thank you so much for adding light to these topics and for your path. It's a very interesting path that I'd loved hearing about, and I'm excited to see more of your engagement in this community.
A couple of thoughts that have come from the interview with Dr. Sam Zand is just that, the ability to be open, that we may not have everything yet, that we're constantly work in progress. Healing is work in progress. And to question everything, look up everything, really be um, autonomous in your decision making, and look inside, use your intuition, see what else can expand you, how other ways, expose yourself, so this is in psychiatry, which is, one of the potentially most closed and hidden, aspects of healing, because it was taboo to ask anything in that field at one point. And now it's really opening, not by everyone, but by enough people, and that's how change happens. So it's very inspiring, and it's a great example of what is possible in healing, and for all of us to be aware of this. So I love meeting people who are, breaking through and advancing this, for the sake of humanity. Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.